Warning, there'll be some cussing in this video. So if you got children around, I suggest earmuffs, or around people that are sensitive, I suggest headphones. You have been warned.
Heart failure.
You have no idea.
Let's take a look at what it is.
Move off to the side. Y'all better be taking notes.
Now, heart failure occurs when the heart cannot pump enough blood to meet the body's demands. In other words, and in nursing in the medical profession, it's decreased cardiac output causing decreased tissue perfusion.
I don't have enough perfusion. Somebody better get in contact with the foot, because you about to kick this nigga in the chest.
Now, let's pause and take a minute to look inside the heart. An anatomy overview. Now, the blood comes back from the body on the right side. It's oxygen poor, goes out to the pulmonary arteries and back in from the lungs through the left side and out to the body, oxygenated. Now, in normal pumping, the atria contract, shoots the blood down to the ventricles contract, and then it goes out to its respective areas, either the lungs or out to the body, depending on which side of the heart you're looking at, right or left. Now, in heart failure, everything's jacked up, everything's awry, everything's backing up because the ventricles don't contract as strongly as they did. This can be due to dysfunctions or other issues. So let's take a look at left-sided heart failure. It backs up to the lungs, remember. There's ventricle issues, systolic and diastolic. Weakened heart muscle, systolic. Problems with the heart filling, diastolic. Note the risk factors are mainly cardiac related, but also obesity, diabetes, sleep apnea, smoking, and old age. Now on the right side, things are going to back up through the veins, which means through the body. Same issues with the ventricles. Risk factors plus pulmonary embolism of note for the right side heart failure. Now for your assessment, you're going to note that on the left side, it's going to mainly be pulmonary issues, dyspnea, orthopnea, tachypnea, crackles in the lungs, and cough. Right side, it's going to focus on systemic congestion, so ascites, anything having to do with fluid overload. These are the diagnostics that you'll mainly see MDs order in the hospital when it comes to diagnosing heart failure. As far as planning, you want to make sure that you're taking daily weights, giving oxygen, high Fowlers, and those associated medications, and reducing sodium and fluid intake. Watch your I's and O's. And interventions, not noted here, is high Fowlers, oxygenation, but make sure you educate the patient on lifestyle changes and give the medications that are needed. Not noted here is digoxin is one. Watch your diuretics. As far as hypokalemia levels and your electrolyte levels, you may need to replace those. Also watch your I's and O's and daily weights. Now, as far as evaluation, it depends mainly on what your interventions are. So if high Fowlers, make sure that you reevaluate the patient, check the vitals, work of breath, SpO2 is important, respiratory rate, fluid restrict. So make sure that the electrolytes are being monitored and that you're looking at your I's and O's and measuring them against the previous ones. As far as your nursing diagnoses, here are the most common. Decreased cardiac output is going to go hand in hand with ineffective tissue perfusion. Excess fluid volume may be for right-sided heart failure because of all the fluid overload. Ineffective breathing pattern and impaired gas exchange are more for the left side of the heart as well. Also note your complications. Pulmonary edema is a complication, acute decompensated heart failure, arrhythmias, and renal insufficiency. Always prioritize safety for the patient as well. Now go and be a great nurse.
Alright, making these lifestyle changes, but if you keep fucking with me, I'm just gonna end up stopping. You hear me? Then you better know some shit. And I understand C is good degrees, but you better do your damn best.